So, welcome everybody to our session on everything you know about Medicare. We have Sam George and Amanda Sharp joining us from Medicare Done Professionally here in Overland Park, Kansas, where Sound Stewardship also operates from. My name is Matt Syverson. I'm the founder and senior wealth advisor at Sound Stewardship. I love serving clients in all areas of their life, but I am not an insurance agent. So especially when it comes to Medicare, we need to collaborate and interact with the professionals that can help you with Medicare. And it's quite a puzzle to solve. Fortunately, we're going to go over the A, B, C's, and D's of Medicare today. And trust me, every letter will be covered. Sam George is joining me, and he's the principal of Medicare Done Professionally. He's got over 40 years in the insurance business, specializes in Medicare. He knows all the ins and outs, but at the same time, he's humble enough to say, I don't know the answer to that, so I will get back to you. What we're going to do today, it'll be up to about an hour. What we'll do for starters, since some of you are already on Medicare, is he's going to start with some 2025 updates that you may not be aware of, because that's right around the corner. So then you can get some of that right away. So if you know all the A, B, C's, and D's of Medicare, you can bow out if you want. It's going to be a great show the whole time. So if you got nothing else to do today, please stay with us. But then for those who are just about to get on Medicare or just wondering about all the ins and outs, stay with us, and there'll be an opportunity to answer all your questions. Below at the bottom of your screen, you should see a Q&A, and Amanda Sharp, Sam's daughter, and one of the associates at the firm that helps as well. She'll be curating those questions and will help you get that answered. We're going to try to leave enough time to get it answered during the hour, but if we happen to need to stop, then we'll absolutely give you their MDP's phone number so you can call and follow up later. So without further ado, Sam, take it away. Help us know everything we need to know about Medicare.
Okay, well, great. Thanks so much, Matt, for having us stay. Welcome, everybody, wherever you are around the country. Hoping you're having a great day. It's a beautiful day, fall day in Kansas City. So, yeah, we're going to overview Medicare. So just a quick update. Some maybe, if you're watching the election closely, you're hearing some information being talked about how we're finally doing some things on prescription drug coverage, which is a good thing. It's been needed for many years. 2 years ago in 2023, there was a law passed called the Inflation Reduction Act. A big part of that law impacted Part D of Medicare prescription drug coverage, and they're phasing it in over multiple years. So immediately, part of that act was to put a cap on all diabetic medications so that you had to a set small copay no matter what kind of diabetic medication, even things like Ozempic and Trulicity. Then last year, they phased out or phasing out the catastrophic, what's called the catastrophic phase, meaning that those of you that are familiar with or have ever heard of a thing called the donut hole, that was phased out. So once you hit that, you didn't have still to continue to pay cost. This year, or coming up in 2025, they are going to, the biggest part of this is they're going to cap, worst case, once your total out-of-pocket copays and Part D deductibles reach $2,000 in a calendar year, they're going to cap that, and so you're at 100% the rest of the year. So the crazy thing called the donut hole is going to go away. My mother is extremely happy about it. She goes through the donut hole every year. So another thing that they're adding that for some people may help them is they're allowing them to elect what's called a smoothing effect. So you can, instead of having like a big $500, almost $600 deductible because you're on a drug that triggers the deductible, and you go to the pharmacy and you have a considerable big expense the first month because you're triggering a deductible, they're letting you smooth that out. So let's say you had a $700-800 expense the first month because of deductible, et cetera. They'll say, hey, you can just, give us $50, $60, $70 a month over the next 12 months. You can opt into that smoothing and aspect of cost anytime during the year. And so this last bullet, it's kind of getting a little bit into the weeds about what's going on. We've kind of created, unfortunately, this perfect storm this year, and I say this year, going into next year. All these are positive things that are happening, but like with anything, there's kind of a negative or, the bad news part of it. And so those of you on the call that are on Medicare may have gotten a letter in the mail in September saying, oh my gosh, my prescription drug premiums are going from a very small amount to a very high amount. Or even in some parts of the country, things like my Part C Medicare Advantage program is changing considerably or maybe even going away. So Medicare, in order to help offset or the costs, they shifted a little bit more of the liability or burden to the insurance companies and to the pharmaceutical industries on Part D, as well as then Part C plans. They shifted some of the subsidy. The reason a Medicare Part C plan, which a lot of you may have, has zero premium is because the government subsidizes the cost, which allows the insurance companies to charge zero, where they cut that subsidy back going into next year. So a lot of plan changes on Advantage funds. Kansas City, those of you on the call in this area may have heard that our Blue Cross Blue Shield locally of Kansas City is completely pulling out of the Medicare Advantage market. And so 33,000 customers are going to lose their Advantage plan. And a lot of the other plans, United Healthcare, Aetna, Humana, have had some fairly significant changes. So it's kind of that whenever we have significant change for the better, there's always a little bit of a downside of it. So the good news is we're going in the right direction, but it's going to be kind of a disruptive year this year, maybe even into 2026 a little bit. So those are all things that, we help people take a deeper dive in and show them more specifics of their situation. If they want to look at, okay, what's the impact upon this stuff for me? So again, we're going to focus on what we call the A, B, C's, and D's of Medicare. So the 4 parts of Medicare. And I like to say that we present this to you from like a consumer's point of view. People told me many times over the years, they said, Sam, I've been to a lot of these meetings, but I finally get it. I like the way you present this. You present this like I want to hear it and understand it from my perspective. So let's start with what is Medicare? Well, Medicare is primarily our national federal health insurance program, primarily for people 65 and older, but certain people that are under 65 that have certain disabling conditions immediately qualify for Medicare at any age. End-stage renal disease, Lou Gehrig's disease are a couple of the big categories that people immediately qualify. Or if somebody has been disabled for 24 months, they then also could become eligible for Medicare. So about 12% of the people in Medicare are under 65 and also have Medicare. So Medicare was started in 1965 under Lyndon Johnson. You'll hear it referred to as original Medicare, Medicare Part A and Medicare Part B. That's what was passed into law July 30th, 1965. Medicare this past July turned 59 years old. This is kind of a fun slide. It puts into perspective what's going on today. A number of years ago, they tracked this lady down, Kathleen Kirchling, and looks like she does okay for herself, and determined that she was the first baby born a second after midnight 1946, kicking off a 20-year span after World War II, where over 80 million babies were born in the United States, thus the baby boomers. Today, we're kind of at the peak of the tsunami of baby boomers. About just a little less than half of those 80 million were born from like 56 to 63. And so we've got this huge wave of baby boomers hitting 65 right now. They say on any given day in America, as many as 14,000 people could be turning 65 every day. And that's going to continue until 2030. Right now, and the number changes pretty rapidly, but it's probably more like about 66 million people are in the Medicare system. If trends continue and we don't have another COVID pandemic that like target older people and seniors, then we could have as many as 80 million people in the Medicare system by 2030, which is a wow factor. That would represent, statistically, they say about 23% of our total population will be on Medicare. So who runs Medicare? You'll hear me refer to it as Medicare, the federal government sometimes. Technically, CMS, Centers for Medicare and Medicaid Services. They oversight and set the rules and conditions on Medicare. They coordinate with all 50 states between federal and state on Medicaid. And they are also responsible for oversight and regulation of the Affordable Care Act and individual health plans. Not so much anymore, but they're still somewhat referred to as Obamacare, but they're kind of trying to move away from that term. Now, your doorway or gateway to access or enroll in Medicare is via the Social Security Administration. So the 4 parts of Medicare explained. So Part A of Medicare, that is the hospitalization benefits of Medicare. Very comprehensive benefits for being in the hospital. You've been in the hospital, you need rehabilitative care, skilled nursing. You're now at home, you need home health care professionals, or you've been diagnosed as being terminally ill, very comprehensive benefits for hospice. My mother went through all 4 phases of this a couple of years ago. And between her Medicare and one other aspect, her supplements, she didn't get a single bill for anything. So very, very comprehensive coverage for hospitalizations, rehabilitation, home health care, skilled nursing. Part B of Medicare is all of your care outside of the hospital. So that's your doctors and specialists and outpatient procedures, surgeries, labs, x-rays, MRIs, CAT scans, any of your medical equipment that you need, wheelchairs, walkers, beds, oxygen tanks, even CPAP machines for sleep apnea, all of your expensive treatments that you get done at a hospital, clinic, doctor's office, like infusions, shots, chemotherapy infusions, radiation for cancer, those are all covered under Part B. And then all your annual wellness screenings and exams. There's like 26 different things that you can get done under the wellness umbrella that all healthcare covers, including Medicare, at no cost. Annual wellness exams, flu, pneumonia shots, colonoscopies, women's well checks, etc. So that is what is known as original Medicare, A and B, put in the law 59 years ago, July of 1965. Part C of Medicare, this is where a lot of the noise and confusion and kind of swirl of Medicare comes into play. Medicare Part C was put into law in 1997. It was as a result of a concept that started way back in the 70s in California with a healthcare organization called Kaiser Permanente. They came out with what was the first health maintenance organization, HMO. As that concept over the next 20 years moved across the country, by the late 1980s, early 1990s, most healthcare plans in America, including especially employers, had moved or changed their healthcare plans to a network-based model of care. So health insurance companies were forming networks and having HMO plans or PPO plans, or now we even have EPO plans, exclusive providers. So Medicare said, it was under Clinton's administration, that sounds like a pretty popular concept. We need to have an alternative way that people can get Medicare that the private health insurance companies could offer. So they came out with Part C of Medicare. Today, they're known as Medicare Advantage plans. These operate very similar, like those of you that had coverage under a company plan at work or an individual health plan, very similar, network-based. PPO plans have your bigger networks go in network, get lower cost, but still could go out of network, pay more. They have HMOs, health maintenance organizations, where you go to the in-network providers unless it's an emergency. You don't have an out-of-network option. And they even have in-betweens now. They have HMO point of services that are kind of in between an HMO and a PPO. And so the good news is there's all kinds of variations of these plans out there. All your major insurance companies like United Healthcare, Aetna, most all the Blue Crosses. Unfortunately, Blue Cross locally doesn't anymore. Humana, and then there's other companies, Cigna, WellCare, and then regionally there's companies that do this. So these plans are heavily regulated by CMS Medicare, so they have to cover everything that original Medicare A and B covers as far as healthcare. And they have the Part D prescription drug built into it in all night neat package. And the big advantage, and we'll go into this a little more detail, is that these plans don't have an additional premium. They are zero premium. So how does that happen? Well, when you do one of these plans, the government takes part of those taxes you paid into the trust fund, that all your work life and your employers match that, and they give that to the insurance company you enroll in with. They call it a subsidy. And so depending on what part of the country, et cetera, it can vary, but like in Kansas City, it's about $14,500 a month or about $18,000 a year they'll give, pick a name, in United Healthcare. And then United Healthcare's goal is to offer zero premium to the people on the plan. So we'll take a little deeper dive on these. These plans have become very, very popular. And then the last part of Medicare is Part D. That was put into law in 2006. Original Medicare A and B doesn't cover things you go to the pharmacy to get. It covers expensive treatments like infusions, shots, chemotherapy, radiation, but it doesn't cover things like, blood pressure, pain medication, diabetic medications, et cetera, that you go to get through the pharmacy. So those are the four parts of Medicare, A, B, C, and D. Again, I talked about Part A, the hospitalization, skilled nursing, home health care, hospice care. Original Medicare A, and then B, all of your care outside of the hospital, surgical procedures, labs, x-rays, cancer treatment, preventative services. Your universe of healthcare providers with original Medicare A and B is every hospital in America. And last stat, just shy of 99% of all doctors in America will take original Medicare. Even places like, if you want to go to Mayo's Clinic, or you want to go to MD Anderson or Johns Hopkins or specialty hospitals, universally Medicare is accepted just about by everybody. These are the annual wellness screenings and exams that came about as a result of the Affordable Care Act in 2010. So all healthcare in America has to cover these plans one time a year, 100%. And they've added a few more things recently, shingles vaccinations, and of course the various COVID vaccinations, along with flu shots, et cetera. So these are the 26, I believe, different preventative screenings and exams. So does Medicare cost me money? Well, I paid taxes into the trust fund my whole work life. So you get Part A at no further cost. They call it premium-free Medicare because you pay taxes into the trust fund and your employers are matched. Now, Part B of Medicare, there is a monthly cost. And they put in what's called IRMA, income-related Medicare adjustment amount, a number of years ago. And so they basically were saying to us, hey, we got to get more money coming in the trust fund. People are living too long. We never anticipated that we were going to have that many people living beyond the age of 90 even. So they came out with IRMA, and basically when you sign up for Medicare, those of you on the call that are on Medicare know that you get every year a nice letter from Medicare that says, here's what your next year's monthly premium is going to be. And so there's a base premium in 2024 of $174.70. That premium has just been announced that it's going to go up to $185 January 1st. And based on your 2 years back prior income on your tax return, you could get a load on your Medicare Part B, and they also load Part D prescription, the Part D prescription drug coverage. But the number on the far right of the screen is the number you basically file individually or jointly. You look at they look at the bottom line on your tax return 2 years back and determine what bracket you're in, and then that's the number you pay until they look at it again a year later. So once you're on Medicare, They look at it every year, 2 years back. So for some people, it might be a little bit of a roller coaster ride. It could go up, then come down. I get calls all the time. People say, why did I get a big increase in my Medicare? My first question is, well, did you win the lottery? And most often, no. But, things like selling a house or a property, inherited money could cause maybe your financial advisor, wealth manager, you've done something that caused your income to go up a little or a lot. So it can fluctuate from year to year. Now, Medicare allows you to appeal that. So if you say 2 years ago, yeah, we were making good money, or I was making good money, but I'm 2 years, I'm getting ready to retire, go on more of a fixed income. Medicare says, hey, bring this one-page appeal form to the Social Security office, give it to us. And if you've got a sound reason why your income future forward is going to be less, then most often they'll award your appeal, but realize that they're going to, of course, look at it every year. Usually just retiring and stop working is a life-changing event that qualifies you to appeal it. So that's IRMA, Income-Related Medicare Adjustment Amount. So Part C, Part D, again, all services of original Medicare. The big advantage is no premium. They're offered by health insurance companies, but you do have costs when you use the care. They're called copays and coinsurance. So go to see a primary care doctor in network, typically zero, see an in-network specialist. Depending on the plan, it can be anywhere from as low as $20 up to $40, $50 office visit. Specialist says, let's get a test or procedure done. Under one of these advantage plans, it could be as small as $0 to a few dollars for a lab work or an x-ray, to as high as 160 to 70. And I'm giving you general numbers. In other parts of the country, like East Coast, Florida might be a little higher for one of those conditions. Worst case, Medicare CMS says all plans must have a maximum annual out-of-pocket threshold. They call it a MOOP, M-O-O-P. And once you reach that maximum out-of-pocket threshold in a calendar year, you're at 100% for the remainder of the year, and then everything resets starting January. Again, there are variations. It's not uncommon for an insurance company to have 5, 6, 7, 8 different plans in a metropolitan or regional area. They could have PPO plans and an HMO plan and an EPO plan. So to make you think, okay, 0 monthly premium, don't have a big front-end deductible like I had at my plan at work. It works very similar. Wow, that's pretty appealing. Well, to even make these plans more appealing, Medicare allows these plans to include all kinds of extra benefits at no cost. So original Medicare doesn't cover dental, things you go to the dentist to get done, cleanings and exams. These plans, some of them have as much as $2,000 to $3,000 of annual dental benefits at no cost. Original Medicare doesn't cover routine eye care, getting an annual eye exam, getting an allowance to get new frames and lenses or contact lenses. Most all of these plans have a nice, they all cover an annual eye exam. Some of them will have anywhere from $150 to $300 allowance to get new glasses, contact lenses every year. Original Medicare doesn't cover hearing exams and hearing aids unless it's a medical condition that cause most. Medicare considers most hearing loss to be self-inflicted, that you shouldn't have been shooting that gun next to your ear without earplugs or having your head right next to a big speaker in college. But if it's a medical condition, I had a stroke or I have Meniere's disease, then that's considered medical. But for the most part, these plans will include an annual hearing exam, and many of the plans have to as much as $3,000 a year that you can get hearing aids per ear. They always say per ear because some people don't need hearing aids in both ears. A few years ago, or probably about 5 years ago now, they added a new benefit called an over-the-counter non-prescription allowance benefit, OTC. So you can go to pharmacies, or in many instances now you can go online to like CVS and some of the big pharmacy chains, and you can pick from a myriad of different non-prescription items: Band-Aids, aspirin, toothbrushes, toothpaste, mouthwash, vitamins, over-the-counter allergy, pain medication. I mean, there's a myriad of things you can pick from, and they give you an allowance. Some of the plans have as much as $80 to $100 built into your card every 3 months that you can use to get those kind of items. It's kind of a use it or lose it with most all plans. If you don't use it, it doesn't carry over to the next 3 months, but it resets every quarter. Many of the plans have meals. They know that you've been in the hospital, and they're going to automatically deliver when you get discharged. They're going to deliver a week's to 2 weeks worth of meals to your house, so you don't have to cook. Unfortunately, a lot of the plans have kind of moved away from transportation benefits. There's been, unfortunately, some liability and been some situations that they've kind of moved away from that, but there still are some for some really specialized specific advantage plans that provide transportation if you can't drive to and from medical appointments. They all have a health club membership benefit. So you can go to just about every health club in your area at no cost, all the community centers, YMCAs. You can go to multiple health clubs. A lot of people don't realize that. You could go to 2, 3 different clubs in a week, all at no cost. So you add it all up, and these plans have become very, very popular. And then the last part, prescription drug, as I had mentioned earlier, some big changes happening on that front. All Part D drugs plans, again, are regulated heavily by CMS, Medicare. They all structurally have to work in the same format where they have a formulary, and their formularies, no matter what plan they have, has to cover at minimum 2 medications in every medical therapeutic category. So very comprehensive coverage. They have, well, this slide says 6 tiers. They've actually this year moved it back to 5 tiers. So they've eliminated the select diabetic because they put the 2,000 cap. So you have a tier 1 preferred generic, a tier 2 generic, a tier 3 brand drug, a tier 4 non-preferred, and then a tier 5 select specialty tier, which is for the very expensive drugs, things, as I say, you see advertised on TV. Many of the plans have a deductible. It's actually going up to $590. Medicare sets that level in 2025. What triggers that deductible is not typically generic drugs or tier 1 and 2 drugs, but a tier 3 brand, tier 4, tier 5 drugs trigger the deductible. So if there's one slide you walk away from today and you go, okay, I kind of see the roadmap or the blueprint for Medicare, it'd be this slide. So we kind of came out with this a number of years ago, my partner and I, and said, people struggle with the differences between A and B and C. And so we kind of come up with a slide we call it the left side and the right side. And so when you start your journey for Medicare, your first step is you have to be enrolled in Medicare A and B. Some people out there can enroll in A only. It doesn't hurt you. It sits quietly in the background. But to do the rest of the parts of Medicare, you have to be enrolled in A and B, be confirmed, have a Medicare ID number, and then you have to decide, do I want to get my Medicare on the left side, which is original Medicare A and B, very, very comprehensive coverage, go to any hospital, any doctor in America, but, and the big but is, original Medicare only covers 80% of the bill. So you have an unlimited, uncapped, no maximum out-of-pocket, 20% exposure. So you wouldn't want to have that today in healthcare. So you go on down the left and get what's known as a Medicare supplement plan, also known as a Medigap plan. The terms are interchangeable. I think kind of more the official term is Medicare supplement, but if you see Medigap, it's the same thing. These plans are all federally standardized by Medicare, so they all work exactly the same no matter what insurance company with original Medicare. So the combination of Part A of Medicare and a Medicare supplement plan, and I'm going to use the G because supplements have letters like parts of Medicare. The G as in Great Plan is the most popular plan today. So the combination of Hospital A and a Medicare Supplement G plan, you have 100% coverage. No deductibles, no copays, pretty much set it and forget it. Go to any hospital in America and you won't have any out-of-pocket expense for hospitalizations, rehabilitation, home health care, skilled nursing. Part B of Medicare, in conjunction with a Supplement G plan, it picks up basically Medicare B covers 80% of the bill. You'd be subject to the 20%. The supplement picks up the 20%. The only thing that Medicare law as of 4 years ago says that any supplement cannot cover is Part B has an annual deductible. This year it's $240. Next year they just announced it's going to $257. So once you satisfy $257 next year, you're at 100% coverage. And basically that's seeing a doctor, you'll satisfy it. So the combination of A plus B and a supplement G, $257 one-time deductible a year, go to any hospital, and just about every doctor in America, 99% of all doctors, there's a small fragment of doctors, concierge doctors that don't take any insurance, and a handful of psychiatrists that have small practices. But other than that, it's your universe is everybody. And then, of course, you'd want to add a prescription drug plan, Part D. A lot of the, well, not all, but most all the insurance companies, health insurance companies offer Part D plans. In Kansas City, we've got Part D plans for as little as $0 monthly premium for plans that have very good coverage. The alternative, of course, is the right side, Part C of Medicare, Medicare Advantage plans. Has to cover everything that A and B covers, includes that Part D packaged in one nice, neat package or plan. And then all those extra benefits you get to dental and vision and hearing aids and hearing exams and health club membership and over-the-counter allowance and maybe transportation and all of that. So people go, wow, that's very appealing. I'm in pretty good health, but I go to get my annual exam, but gosh, I can use the dental and the vision and the over-the-counter and the health club. So you can get many $1,000s of value-added benefits with these Advantage plans for being in good health. So they become very appealing. About 55% of people have the right side or Advantage plans today, and about 45% have the left. Again, the big advantage with the right is $0 monthly premium. You still got to be enrolled in Medicare A and B and pay your monthly premium for B, but then you don't have an extra premium for a supplement, like on the lower left there. On the left side, supplements have a monthly premium, and just depending on, they're very state specific in their pricing. They typically price based on gender. Females pay a little less than males at the same age, so you don't pay that premium for the supplement. And if you have a drug plan where you have to pay a premium, you don't pay a premium for a drug plan that's built into and part of an Advantage plan. So people go, well, gosh, why wouldn't I do an Advantage plan on the right? It's a $0 premium. I'm familiar with the concept. I've had that same kind of concept at work for years. I get all those extra benefits. And then let's say 4 or 5 years from now, my health turns and maybe I've got a chronic condition or two. And maybe now I'm hitting that $4,000, $5,000, $6,000 out of pocket max every year. And maybe I can't go to the doctor I want to go to, because your universe of doctors on the right side is still very good with many of the plans, but it's not everybody. The left side is everybody. Places like Mayo's Clinic, MD Anderson, places like that, most all plans, you can't, Advantage plans on the right, you can't go to those specialty hospitals or clinics. So people go, well, doesn't Medicare allow me to change every year like all healthcare? So isn't there a time I could disenroll from that Part C plan, basically pull original Medicare from the background to the forefront? Because when you have an Advantage plan, Medicare just moves into the background quietly. Isn't there a time of year where, yes, every year Medicare has what's called the annual enrollment period. It's right now, October 15th to December 7th, 7-week period every year that you can change plans on the right side or disenroll from a plan and go to original Medicare A and B and then apply for a supplement. So the operative term is apply for a supplement. So when you first sign up for Part B, you trigger a one and only one-time window in your Medicare lifetime called an open enrollment window to get a Medicare supplement. No questions asked, no pre-existing, have to prove you no matter what's going on. You only have one of those. It lasts 6 months. Once it closes, it never opens again. And so people do Advantage plans and don't realize down the road then that I would have to answer health questions with the supplement and I could be declined. Probably one of the biggest complaints Medicare gets every year is that, well, nobody ever told me that I wouldn't be able to get a supplement down the road. I thought all healthcare let me move back and forth at will. So that's probably the biggest thing to understand is you can't go wrong either way. They're both great healthcare plans, very popular. It's like an apple and an orange. They're both great pieces of fruit. They taste great. They're good for you, but they are distinctly different. So just understanding the differences. On the left side, you don't get dental and vision and health club membership and all those extra benefits. You'd have to purchase those on your own or on a standalone basis. But your universe of healthcare providers on the left is everybody. Medicare A and B is not state or area specific. It's the same no matter what state of the country you're in. Supplements can vary a little bit in their pricing from, East Coast is going to be more expensive than Midwest on supplements. But the supplements all work the same. The way a supplement simply works is you show your Medicare card, you go to a healthcare provider, they send the claim to Medicare, Medicare reimburses them, Medicare behind the scenes sends the claim to your supplement insurance company. You don't have to be involved. And when your supplement gets it, they have to pay their 20% short of the $257 deductible, and they have to pay it very promptly and quickly. And one of the nice things, again, about the left too, is it's very, very easy peasy process to work through. No pre-approvals, no networks, etc. So let's talk a little bit about election periods. I call it the alphabet soup. Medicare loves, and our government loves acronyms. So everybody, when they first turn 65, has what's called an IEP, initial enrollment period. They give you a 7-month window to enroll in Medicare. 3 months prior to the month you turn 65, they give you the month you turn 65 to enroll. Then they actually even give you a 3-month parachute on the back end of your 65th birthday. So when you enroll at 65, your effective date is always the first of the month that you turn 65. And then that IEP also applies to enrolling in a supplemental plan, a drug plan on the left side, or an advantage plan on the right side. SEP. Most people today enroll in Medicare under a special enrollment period. Basically, anybody that goes more than 3 months beyond the age of 65, and then down the road, let's say retires, leaves an employer plan, then they are in what's called a special enrollment period. Still affords you all of the guarantees of being approved for Medicare and drug plans and supplements and advantage plans on the right, but your window shortens down to a 2-month period prior to the date you want Medicare to be effective. So most people today enroll under an SCP because most people work till their normal retirement age or maybe longer. But again, it affords you all of that. And then there's an additional form that is required that you have to verify or show that you've had credible health insurance coverage, meaning covered under an employer plan since age 65. And that attaches with your application, either online or to a Social Security. There's all kinds of other reasons too, like people that move literally from one state to another or another part of the country have an SEP to change their Part D drug plan that are very state specific, or a Part C Advantage plan, because Advantage plans are very regional, zip code specific, moving in and out of the country. So there are all kinds of different things you have SEPs awarded to you for. And then we've talked about the supplement has your one and only one-time open enrollment window. It's when you first sign up for B. There can be slight variations from state to state. There are a few states now that have elected what are called guarantee issue periods, where you can change a supplement on your anniversary or your birthday without health questions. It's called guaranteed issue. It's not open enrollment. And so there are a handful of states, if there are people on the call, that also can take place. Annual enrollment period, we've already touched on this, and we're in it right now. It starts October 15th, goes to December 7th. They picked December 7th because that was a pretty big day in American history, so people would remember the end date. So it applies to, it's AEP for Medicare is primarily for people that are already on Medicare, gives them an opportunity every year to change maybe from one Part C Advantage plan to another, or change a drug plan to another drug plan. But it also is a time where you can disenroll from the right side in Advantage plan and engage Part A and B as your primary care and apply for a supplement. They've also now even added an additional period. They call it Medicare Advantage open enrollment period. So the window closes December 7th, shuts for 3 weeks, and then January 1st, it opens up again for people that have Advantage plans if they had second thoughts and said, oh, on second thought, I want to change to another Advantage plan. So they give you another window to change Advantage plans only. So basically, how do you enroll in Medicare? Well, there's really only two ways or three ways to enroll, but the way they really want you to do it is online. And so those of you on the call, hopefully you have what's called an online My Social Security account. And so it's real simple to enroll for Medicare online. You could go to a Social Security office. Good luck with that. If you've been to one recently, they're very busy places, and sometimes you can't even get in the front door. They tell you you set an appointment before you come in. This is the screenshot at the top of the Social Security website, right in the middle, apply, sign up for Medicare. The lower left is kind of a screenshot of setting up or creating a My Social Security account. Highly recommend people to do that if they haven't done that and are not enrolling in Medicare, because you will be required to have that in order to do the online application. And then there's just a kind of a screenshot of a login field. This is what a Medicare card looks like. Have your formal name. It'll have a random series of 11 letters and digits, and then Part A and B effective dates. And some people, Part A is a different date than Part B. Some people enroll in Part A, continue to work. Part A just kind of sits quietly in the background, and then enroll in Part B later when they retire and come off of an employer plan. Do I need to sign up for Part A? Again, it doesn't hurt you if you're going to work, but one of the big myths of Medicare is I have to sign up for at least Part A, and that's not correct, especially if you are contributing pre-tax dollars to a health savings account. Once you sign up for any part of Medicare, you cannot continue to do that. So I know Matt and people would probably tell you that's short of maxing out your retirement benefits. HSAs are maybe one of the better things you could put money into, because you will use the dollars. This is a kind of an overview, but you can use that to pay that Medicare Part B premium. You can use it to pay any out-of-pocket expenses, dental, vision, hearing. So there's all kinds of things you can use. You can even use it to pay long-term care insurance premium policies. So if it was a decision, should I sign up for Part A and no longer putting money into an HSA, I tell you, continue to put HSA. Don't sign up for Part A until you're ready to retire. B, you have to do the left side or the right side. Now, you don't want to sign up for B until you're ready to come off whatever coverage, primarily employer health care, because people think, well, I'll sign up for A and B and it'll become like a supplement to my employer plan, pick up my deductibles, and all that. Doesn't work like that. Your employer plan is always primary, and Medicare just sit quietly in the background. Plus, remember, when you sign up for B, you trigger that window to get the supplement. So you don't want to sign up for B until you're ready to fully disengage from your health can at work. If there's somebody that works at a small company or owns a small company with less than 20 employees, Medicare gives small companies a break. They do then automatically make Medicare primary for anybody on a small company or spouse at age 65. So yes, you definitely do have to sign up for Medicare then, because the insurance companies will treat Medicare as primary and they're as secondary. So any veterans on the call, thank you so much for your service. They could be a little bit of a slippery slope for veterans if you qualify for VA healthcare benefits. The federal government, Medicare, doesn't consider VA healthcare as credible coverage. So veterans out there, if you're going to go to the VA, make sure you sign up for Medicare A and B at 65, because if not, you start accumulating a late penalty, and down the road, you sign up for Part B and you're going to get assessed a 10% late penalty for every year beyond 65 that you didn't have credible health coverage. So it's important for veterans. Veteran prescription drug coverage, or VA, is credible. So veterans sometimes go and get their drugs from the VA because they have very low copays, and they have special advantage plans just for veterans. They call them Medicare Advantage only, knowing that they get their prescription drugs. They dub them as Patriot plans or Eagle plans. This is a form I mentioned earlier, 564, verification of credible coverage beyond 65. This is a really great book. It's called Medicare and You. I tell people we don't make this stuff up. Unfortunately, most people don't get this book until they've been on Medicare a year or so, but you can download it, www, or just Google Medicare and You 2025. It's a great book. There's a lot of good information that you can get from this book as well. What's not covered by Medicare? Well, we talked about dental, vision, hearing aids, hearing exams, long-term care. It'll cover your health care in a nursing home or assisted living. It just doesn't cover the room and board costs. And then, of course, cosmetic surgery. Again, we talked about Part B. There's a 200, next year will be 257. It picks up the 20%, or Medicare Part B has a 20% coinsurance. Then Medicare also has what's called a 15% allowable charge, or excess charge as it's known as. So again, supplements, there's 8 of them today. Some people on the call may even have qualified and have a Plan F. There used to be 10 plans. They sunsetted the F and the C plans in January 1st, 2020. Those of you that have them can continue them, but no new people can get an F or a C. So we're down to 8 plans. And this is the standard chart right out of that Medicare and You book. And so the plan right in the middle, the G, is the most popular plan. It covers everything except the 240 next year, 257 deductible. It also picks up what are known as the excess charges of Medicare, which is the only supplement that picks up an excess charge if the healthcare provider that you use was awarded additional reimbursement because they had extra special circumstances or expenses. Then you never have to worry about getting a bill for 15% of those charges, any of the other supplements you do. And so we've kind of summarized here, the Advantage plans are very popular today, and they've really moved the needle probably the last 4 or 5 years. Medicare really likes and wants people to do these plans. That's why they have these plans. They subsidize them to the point of getting 0 premiums and all those extra benefits. But you do have a network that you have to work within. So not every healthcare provider accepts Advantage plans or is in network with the plans, but it has the drug coverage. Plans vary greatly from area to area. So even though United Healthcare has a very popular plan in Kansas City, it's a completely different plan in Florida or Georgia or even St. Louis. But then all those extra benefits that you get make these plans very, very appealing. But the networks do change from year to year, and this year maybe more acutely we're seeing some changes that we haven't seen in the past. We're starting now to see some hospital groups that might say we're not going to work with Humana anymore or Aetna. We'll work with United Healthcare or Blue Cross. Most plans like you to have a primary in-network primary care, refer you to see an in-network specialist. Again, 0 premium. And then there's really one time that you can go to a plan or change a plan. It's the annual enrollment period. So guys, with that, I know we ran a few minutes long, but thank you so much today. Hopefully this has been informative. This is our information, emails, or those are our direct lines. I think at the beginning, we also gave you a general office phone number. I work in, I think, last count, 37, 38 states that I can work within in the United States. So I can, and even if I'm not in a state, I have resources that we can help you in any state in the country. I haven't had anybody in Alaska yet, but I'm in most all states. With that, I guess, Matt, Amanda, do we have any questions?
Yeah, Amanda's been addressing them along the way. So that's so helpful, Amanda. Thank you for doing that. And folks, one reason, there's multiple reasons we had Sam with Medicare done professionally today, but because he has that national exposure, just like Sound Stewardship serves clients all over the country, we wanted you to be able to have a resource that can help you in your state, not just the Kansas City area. In fact, Sam, I've got 2 questions right out of the gate that I'll run by you that just came up this week. And then if you have a question on the call, please go to that question and answer section, type that in, and then Amanda will queue that up for us. So she might just handle it if we're kibitzing about something, but I'll just be aware of that. And we'll go no more than about 10 more minutes. So question 1 was a lot of our clients snowbird. And so they're spending, they have a primary state, but they're going south for the winter. But eventually one of our clients is considering going south permanently one of these days. And we're concerned that if they move from the Midwest down south, they're going to have to change their whole plan and have to reapply and all those good things.
Yeah, great question.
Or bad things.
Yeah,
And
great
they're on the left
question.
side. They're on the original Medicare with I think they might still be on Plan F, grandfathered in, or maybe Plan G with Part D. So what would you tell a snowbird that's considering the move to the permanent southern state?
So Medicare A and B is universal, the same in any state in the country, and thus supplements. So if you have a supplement in Kansas or Missouri, for example, and even if that insurance company isn't cited or licensed in the state of Florida, that A and B and supplement go right with you to Florida. Now, you might eventually see an adjustment in premiums because Florida, the same supplemental G plan in Kansas is going to cost you about 25-30% more in premium in Florida because Florida is a higher cost state. Okay. So eventually you might see a premium adjustment for the change of address, but the benefits will be exactly the same and it goes right with you. That's one of the reasons people like the left side is, hey, we spend 3, 4, 5 months in Florida or Arizona, and I never want to have to worry about wherever I'm at that I can go to any healthcare provider I want to go to, and there's not ever going to be a network issue. So the flip side, Advantage plans on the right have gotten a lot better in that regard. That was one of the big rubs for years was they just don't work outside of your immediate area of providers. Well, you can go to any emergency room if you have a serious situation in America with an Advantage plan and be covered as if you were in network. And you can go to any urgent care center in America for a $30, $40 copay, and there's no network restrictions. And most all the Advantage plans have gotten good about that. If you know you're going to be somewhere, and let's say, you know, hey, I get occasional bouts of arrhythmia, I don't want to go to an emergency room, I'm going to see a cardiologist. Well, most all the plans, unless you're in some real remote area, you just do a little homework, or we can help you with that and say, okay, what cardiologist could I go to with my Aetna Advantage plan in Fort Myers, Florida, or Scottsdale, Arizona? And as long as, and there'll be plenty of them that would accept that. So, so even Advantage plans now travel a lot better. But if you want to just have the ultimate, no worries, go wherever I want to go network, the left side goes anywhere in the country.
Yeah. And were you mentioning that they might need to update their Part D because those are driven by the state more than the supplement is?
That is correct. Yeah, drug plans are very state specific. And so just like here where we're at in Kansas City, with a state line right through the middle of town, if somebody moves from Kansas to Missouri or vice versa, we actually have to change and do a new application on their drug plan because they are very state specific. So yes, moving to another state like Florida, wherever you would, and you're on the left side, then you have 63 days is the window Medicare gives you to change your drug plans. If you don't get it done, then you risk then your plan terminating, and then you have to wait till the next annual enrollment period to sign up again, and you're going to have a late penalty. It's not a lot in 1 year, but over it's enough to where you pay it the rest of your life on top of your premium. So
just be aware of the Part D stinker that you've got to make that change within a certain period of time.
And also the same with an Advantage plan. So now not so much like here, metro area, the plans go back and forth, but definitely moving to another region of the country, you need to change your Part C Advantage plan within 63 days.
Okay, gotcha. Okay. Then just had a question come in that Amanda might be would be able to handle, I know, but this comes up all the time for us. You talked about, hey, don't necessarily sign up for Part A right away if you're still employed and wanting to fully fund that HSA one or more times. So the question is, hey, can I make that maximum HSA contribution? Let's pretend we're in 2025. They want to retire in the summer of 2025. Can I make the maximum HSA contribution in 2025, even though I'm going to be done with my employment and not on that plan anymore in 2025. Does that make sense?
Well, by the letter of the law, they say you have to stop contributions 6 months prior to
Yes.
knowing, but how many people know? Sometimes they're forced to go on to Medicare because their employer downsized. So Medicare or federal government really wants people to put money into an HSA. So you have to stop it, by the time you're on Medicare.
Yes.
But I've never seen, I always tell people, ask your CPA or accountant, but I've never seen Medicare come back and say, oops, you contributed, up into the month you went on Medicare, you got to, make adjustments on your tax return and pay some things back. I contributed, for example. There's not anybody on the IRS on the call, is there? No,
I don't think so. Yeah.
I contributed right up till the month before. I forgot to tell my office administrator to stop my HSA contributions, and my CPA said, "Don't worry about it. The IRS is not going to come after you." So, but if you would have continued beyond after you're on Medicare, we probably would have had to make some adjustments. So I tell people that helps. Yes, I have that come up, and I've never had anybody say, "Oops." They came back. So make that lump sum contribution if you want, and you probably shouldn't have any problem.
Yeah. I think the safe middle ground that we've come to at Sound Stewardship, in talking to multiple CPAs that are wrestling through this, is make that contribution up to the point you're jumping on Medicare. So it's going to be a prorated amount in the year that you retire, and then jump on Medicare.
Yeah.
That's probably the safest middle ground. Like you said, if you read the Medicare site, they're going to say, if you are signing up for Medicare in 2025, do not do the HSA in 2025. Well,
I know. Yeah. And you know what? Just again, talk to your CPA, but you will use the dollars. I mean, I've been on Medicare a little over a year. I know I don't look old enough, but I am, and so we're using that money for my wife and I every month to pay our Part B premiums and all that. So it's definitely well used.
Yeah. So then the other question I'll bring up: just visited with a longtime client down in North Carolina, Asheville specifically. Fortunately, her and her husband survived Hurricane Helene. A lot of damage. They're just hurting for their community, and we deal a lot with generosity. They're pouring back into their community because they're okay.
Right.
But she turned 65 January 10th of 2025. Husband works for the state of North Carolina, so they're covered from a health insurance perspective. And she's wondering, do I need to sign up in January at age 65? What we talked about was compare the costs of what it costs to be on the North Carolina plan, compare that with the left side, Part B, supplement, Part D versus the Medicare. Well, we know that with Medicare Advantage, we know what that premium is, right? So compare the left side of Medicare with what North Carolina would do, and if they'll let you stay on the plan, and see what comes out in the wash.
Yeah. Now, it's interesting. A lot of your federal entities are changing. The U.S. Postal Service, they stopped allowing to have that extra special plan. They just told people, hey, you're on Medicare and go find your own coverages. So most all of these state and federal programs say you have to, at 65, sign up for Medicare. That becomes, your kind of base. And then they may provide, their plan as a supplement, and they may say, okay, we'll have some dental and vision and things included. But there are a lot of plans because of the expense are changing these. So, but I'm seeing more and more that they do require Medicare to be signed up. But yeah, there's no question. I tell people, hey, Medicare is always as good as it gets. The left side, it's not a question of if it's better coverage. It's what does it cost you? And if the state of North Carolina is very benevolent on dependents, usually long-term employees are going to be treated very well, but it's how much are they going to contribute towards the dependent spouse, and that's what you have to weigh.
That's it. A little bit of homework. My guess is she's probably going to find it more favorable on the left side, but we will see. But the other thing you answered in the call today, folks are wondering, when you first start Medicare, the coverage begins the first day of the month you turn 65. So for that January 10th birthday, as long as she's signed up before December 31st, then it goes 1/1 of 2025 is when that coverage will begin.
Yeah, and they even in that initial window say, hey, if you sign up in January, you're beyond January 1st, then it's going to be effective February 1st or February, March, April. So they give you a little bit of a parachute on the back end too. But coming off of an employer plan beyond 65 is always a qualifying event to go onto Medicare at any month during the year. So it's never a matter of, oh, I've already elected my plan for the year, so I'm stuck until the end of the year before I can go on to Medicare. No, it's a qualifying event, no matter what month of the year you want to go on. Some people just, decide, hey, I'm done. I want to retire, and it's July, and you can do that.
Yes, awesome. Well, Sam, we are at our 1 hour, and thank you for all the wonderful folks that from all over the country that joined us today. As you know, this has been recorded. We will send the recording out to you over the next week, and it'll be available for you to share with friends and family that are going through this right alongside of you or on their own Medicare journey. So, and NBPRS is available to help you. Again, from most of the states are covered. If you're in a state that's not covered, they will help you figure it out one way or another. As I said, Sam and Amanda are good at, I can't help you there, but let me get you some help over here.
Yeah, we absolutely. And just a short little plug too, if somebody says, well, what do I do with a spouse that's got a couple of years? We also are in all those states with individual Affordable Care Act health plans as well too.
The pre-65 plans that they.
That's right.
Yeah, perfect. Okay, yeah. If it sounds like insurance, health insurance, you can help them. That's
correct. Or get them to where they need help. Yeah, I can't sell you homeowners, but I can maybe recommend somebody. But
okay. Well, Amanda, thanks for joining us and helping out with the questions online. And that concludes our talk today. I hope you've enjoyed all the ABC and D's of Medicare. Have an awesome day, and be well out there.
Thanks so much, Matt.
Thank you.
Bye-bye.